लाहौर में फ़ज़ाई आलूदगी इंतहाई ख़तरनाक हदों को छू गई। एयर क्वालिटी इंडेक्स 400 से ज़ायद रिकॉर्ड किया गया। कराची में फ़ज़ाई आलूदगी के बाइस शहरियों को मुश्किलात का सामना है। सदर, बंसोड, IH चौधरी रोड, टावर और किमाड़ी समेत दीगर इलाके फ़ज़ाई आलूदगी के ज़द में हैं।
लाहौर में फ़ज़ाई आलूदगी का राज बरकरार है। AQI पंजाब के मुताबिक लाहौर का एयर क्वालिटी इंडेक्स 370 रिकॉर्ड किया गया है।
शहरियों को सांस लेने में दुश्वारी का सामना है। फिजाई आलूदगी के बाइस हद निगाह भी मुतासिर हुई है। दुनिया भर में आलूदा शहरों की फहरिस्त में लाहौर दूसरे और कराची तीसरे नंबर पर आ गया। लाहौर का AQI 241 और कराची का 193 रिकॉर्ड किया गया।
जी, लाहौर इस वक्त दुनिया के आलूदा तरीन शहरों की फहरिस्त में पहले नंबर पर मौजूद है। इस वक्त शहर में एयर क्वालिटी इंडेक्स 320 रिकॉर्ड किया जा रहा है।
बच्चे और बुजुर्ग स्मोक की सूरत में घरों से बाहर ना निकलें, ये वाज़े तौर पर महकमा मौसमियात की जानिब से हिदायत जारी कर दी गई हैं।
Article 9A, which was introduced with the 26th Amendment, now states that every citizen is entitled to a clean, healthy and sustainable environment. Previously, and as early as 1994, the Supreme Court of Pakistan had held that all citizens are entitled to a clean and healthy environment. So, frankly, the inclusion of Article 9A doesn't really change the law as it's been for the last 30 odd years. But the state has failed to protect or to enforce this right. And I was reading yesterday a report that I think it's about 2 million people died in South Asia last year. That's India, Pakistan, Bangladesh, because of air pollution. And that is a massive violation of the right to a clean environment. It's a violation of the right to life itself. So yes, the state has failed to protect this right.
फिजा में जब आबी बुखारात की कसरत हो जाए तो बुखारात धुंध का रूप धार लेते हैं और इसी धुंध में जब जहरीले केमिकल्स की आमेजिश हो जाए तो उसे स्मोक कहा जाता है।
पंजाब में गर्द आलूद धुंध ने पंजे गाड़ दिए। कई मकामात पर हद नजर सिफर तक पहुंच गई, जिसके बाइस हादसात भी हुए।
राइस की फसल को काटा जाता है, उसका जो भूसा होता है वो फील्ड में पड़ा होता है। अब वो भूसा चारे के तौर पे इस्तेमाल नहीं होता, किसान उसको आग लगाता है। ये कंट्रीब्यूटिंग फैक्टर भी है।
The air pollution crisis first drew serious global attention around November 2016, when a thick blanket of smog enveloped Lahore and visibility reportedly dropped to as low as 20 meters. Yet none of it compared to 2024, the year when the great smog of Lahore turned the city into the worst polluted air basin on the planet. AQI readings shot past anything seen before. Schools and colleges were closed repeatedly for days. Hospitals overflowed, and according to the World Bank, the annual economic cost of air pollution ballooned into $47 billion as daily life simply stopped. It was undeniable. The smog crisis wasn't a seasonal issue anymore. It was a matter of greater air pollution. Satellite data shows a thick haze drifting in from India's Punjab and Haryana, especially during stubble burning season. To the north lies China, another major polluter in the region. But the heart of the story isn't across the borders. It starts much closer to home, at the center of Pakistan's agriculture.
फैसिलिटीज का ना होना, that's where the story starts. राइस की क्रॉप में ये सबसे ज्यादा हो रहा है अक्रॉस नॉर्थ ईस्टर्न पंजाब, जहाँ पे हमारा बासमती राइस उगाया जाता है, जो ज्यादातर a lot of it is actually consumed within Pakistan. A good part of it is exported also. So this is an export linked crop. और आप हैरान होंगे सुन के कि हमारे किसानों के पास जो राइस के लिए मुनासिब हार्वेस्टर्स हैं वो नहीं है। उनकी एक्सेस, जो नए हार्वेस्टर्स हैं वो एक्सेस नहीं है। 10-15 साल पहले से ये काम शुरू हुआ कि जो गंदम के हार्वेस्टर्स जो बहुत पुराने हैं हमारे पास जो है, उनको इस्तेमाल करना शुरू किया गया राइस की क्रॉप के लिए, वरना हाथ से करते थे। 20 साल पहले हाथ से कटती थी पंजाब में राइस की क्रॉप। आप सोचें 21वीं सदी में हाथ से काट रहे हैं लोग।
It's important to understand why this practice for the burning of rice, burning of the crops, residue especially, is prevalent over decades. It has been a very, very long-standing practice in Punjab, especially because of the easiness to get rid of the crop residue and non-availability of the alternative method, especially the machines. So that is why this conventional and more easy and convenient way of burning the crop residue has been in practice in Punjab for many, many years. Though it has the serious implications for the health, for the crops, for the productivity. And another major reason is non-availability of the machines. And these are the fundamental issues on which the new plan, the new policy of the government of Punjab for mitigating this issue of the crop burning is designed, and we are trying to enable the farmers through the machines. So government of Punjab has, besides many other things, invested heavily in the machinery so that the farmer has the machines to scientifically dispose of their crops, have the harvesting in time, and instead of burning the crop residue, they can have the more scientific alternatives through these machines to dispose of the crop residue.
Pakistan's rice belt produces over 9 million tons of rice every year, and nearly half of it comes from this narrow stretch of northeastern Punjab. The crop is valuable, fast-moving, and time-sensitive, and that's exactly where the pressure begins. Harvesting windows are barely 2 to 3 weeks long. In that rush, farmers without modern machinery are forced into old methods. By some estimates, many small farmers in Punjab still rely on outdated harvesters that shred rice stalks into a tangled mass impossible to collect manually. What's left behind is a residue that cheap machines can't process and labor can't clear in time.
Farmers को ठीक अगर टेक्नोलॉजी मिल जाए तो it can be solved, लेकिन वो हार्वेस्टर्स हैं महंगे, और गवर्नमेंट जब सपोर्ट देती है तो उमूमन ये होता है कि गवर्नमेंट चाहती है कि हम फार्मर को ही सपोर्ट दें डायरेक्टली। अच्छा, वो इतनी महंगी चीज़ है और वो एक दिन में 8-10 एकड़ करेगा हार्वेस्टर, और छोटे फार्मर्स हमारे मोर देन 90% फार्मर्स के पास है ही 10-12 एकड़। तो एक हार्वेस्टर इतना महंगा लेना एक दिन के काम के लिए डजंट मेक सेंस है। ऐसे बहुत से किसान हैं जो सर्विस प्रोवाइडर भी बन जाते हैं, अपना थोड़ा सा हार्वेस्टर अपने फार्म पे चलाया, बाकी जो है दूसरे फार्मर्स को सर्विस दी, लेकिन ये वाला रास्ता जो है जरा इसमें टाइम लग रहा है।
Progress is slow moving and change requires time. Whether or not Pakistan can afford to wait for the effects of newer initiatives to trickle down remains to be seen.
I would highlight farmer health as probably the main impact. The farmers are closest to the crop that's burning. And you spend some time in the rural area, especially evenings and night when the burning often is happening. And you see the smoke is unbearable.
Where rural areas of Punjab suffered due to their close vicinity to the crisis, the impact is felt nationwide. Across Pakistan, the death toll for air pollution-related diseases was 128,000 in 2019. By 2021, this number had doubled to 256,000. And for those living in smog-prone cities, the damage is invisible, but the outcome is very much permanent.
If you've been exposed to air pollution for a short period of time, then absolutely your lung function can reverse so that its impact was a temporary one. But a chronic exposure over time is going to impact your lung function, your lung symptoms, and your overall health significantly. It will impact how many times you get infections, your immune status, your cardiovascular health as well, because a lot of poor lung health can impact your heart as well over a period of time. And it becomes irreversible, so it will become worse over years, and eventually you'll have some kind of illness that you won't be able to survive. PM 2.5 is a very common way that people talking about air pollution understand it. It stands for particulate matter, and 2.5 is the measurement in microns that it refers to. So a particle that's 2.5 is less, you wouldn't be able to see it with the human eye. You would not even be able to see it under a microscope. In addition, air pollution also has a lot of other gases like nitrate oxide or sulfate oxide. These are all other kinds of pollution that are invisible to the naked eye, but they're very much present. And for us as doctors, it has huge implications. For pulmonologists, we care a lot about what's in the air, because the air ends up in the lungs, and what's in the lungs is what's going and feeding the rest of your body. The small size of those particles means that once it's in the bloodstream, it can go to any part of the body and affect it there.
Analysts have repeatedly warned that sustained inaction risks overwhelming healthcare systems and eroding decades of progress in public health. In response, the Punjab government has gone full throttle, declaring a war on smog with initiatives like anti-smog guns, a 24-hour smog war room. They've rolled out a long-term smog mitigation model, banned heavy smoke-emitting vehicles, and sealed hundreds of polluting brick kilns. Even as they amp up environmental enforcement, the Health Ministry's capacity is being stretched by the scale of the crisis.
Okay, sir, but according to the report of United Nations, around 1.8 million people are in need of medical treatment. What is your opinion?
I think that number is less. I think the numbers are more than that. Yes, I do agree with it. The number is more than that. Healthcare starts like this pollution. Healthcare starts from the birth of the child. Healthcare starts from clean drinking water. Healthcare starts from the sanitation in your area. Healthcare starts, the sewage treatment plants. And healthcare starts from the vaccination. The 12, in order to stop and deal with the 12 diseases in Pakistan, we have got the vaccination. All these things doesn't happen in hospitals. It is the out of hospitals business, and all these things does not come under the health ministry. It starts from the local government, from the councillor, because see, the providing the clean drinking water is not an issue of the federal minister of health. Giving them the solid waste management, right solid waste management, is not the issue of the federal minister. So, but at the end of the day, all these things have an effect on someone's health. So when you talk about the healthcare is the name of allowing people not to fall sick. Our system, our environment, the entire country, they are enabling people to fall sick, and then they come to the hospital. So we are not the healthcare system, we are the sick care system of Pakistan. It's a sick care, it's not the healthcare. It's a sick care. We are waiting for the patients to come in the hospital. That's why you see everywhere in Pakistan, the whole hospitals are flooded with the people, as if there's some public gathering has just finished yet, some rally, some political gathering, because there thousands of people are coming in, and thousands of people. How would on this earth you would be able to handle these many sick people, unless and until you won't stop them not to fall sick? Prevention is better than cure, is always better than cure. We are reacting on issues. We are not preempting things. We have to preempt things. And that prevention will come only when we have the third tier of the local government. The ministry can't do anything from the center. It has to be a coordinated effort from central province and the local government. Right now, currently in Pakistan, it will be a unique country in the world which doesn't have the local government. Everywhere, when you see about the talks about environment and curbing the environment, you always see the name of the administration of local governments. Whereas in Pakistan, unfortunately, this local government is missing since decades. Even today, in this era, we don't have any ideal kind of local government. So unless and until the third tier of the government, federal government and provincial government, they have the planning. The execution comes to the local government. That execution part is missing in Pakistan. So whatever good governance plans we made there in federal government or in provincial government, the vehicle is not there to transport that good governance plan to the doorstep of the people of Pakistan. Unless and until that missing link will come into an existence, issues of Pakistan will not be resolved, and here comes the population as well, this pollution as well.
The scale of the challenge is immense. Experts warn that without coordinated action, these figures will only worsen, but coordination difficulties become behemoth as the problem expands. Responsibility for environmental management falls upon provincial EPAs, but with delays in execution, EPAs are forced to deal with punishment, not prevention.
For example, if my neighbor pollutes, then under the Environment Protection Act, I have to write a letter to the Director General of the EPA stating that my neighbor is polluting. And it's then up for the EPA to take action. And if the EPA doesn't take action to my satisfaction within 30 days, I can then go to a tribunal. But 30 दिन के बाद वो pollution कौन रोकने वाला? If the DG doesn't take action, I still suffer for 30 days. I will have bad lungs. I will drink dirty water. My children will get sick. So again, I understand the reasoning for the law that you file a complaint to the DG and you let them do the enforcement. But if the Office of the Environment Protection Agency doesn't have the capacity or the manpower or the ability to prosecute correctly, then my letter will be wasted. And by the time I get to the tribunal, all the tribunal can do is fine my neighbor, but he can't stop the pollution. And so as a consequence, my right to a free, clean and healthy environment, my right to life is being impacted.
Meanwhile, the air pollution crisis has taken on a life of its own. In the south of Pakistan is the world's 12th most populous city, generator of 25% of Pakistan's economy, home to a population exceeding 20 million, and a known ground for infrastructural struggles lies Karachi. By some estimates, Karachi frequently ranks among the top 10 most polluted cities in Pakistan during winter months, with PM 2.5 levels far exceeding WHO safe limits. Unregulated industrial emissions and urban sprawl make it one of the country's most challenging zones for clean air.
आपको पता है कि एक इंटरनेशनल मॉनिटरिंग है एयर क्वालिटी इंडेक्स की, तो उस एयर क्वालिटी इंडेक्स के मुताबिक मुख्तलिफ हम शहरों का मौसम की खबरों में देखते रहते हैं कि क्या क्वालिटी इंडेक्स चल रहा है। उसी तरह से कराची का भी मेरे ख्याल से 7वां या 8वां नंबर है।
हमें तो अभी आप देख रहे हो जुकाम लगा हुआ है, जुकाम छोड़ता नहीं है, ये मिट्टी की एलर्जी की वजह से एलर्जी होती है, जुकाम होता है, अपना जुकाम के बाद बुखार भी आ जाता है, बीमारी फिर इंसान को जैसे लगती है तो बढ़ती ही जाती है, रुकने का तो नाम ही नहीं लेती।
अगर देखें तो आप हॉस्पिटल जाएँ तो सारे हॉस्पिटल इसी बस के अंदर भरे हुए हैं, और आज का जो मौसम चल रहा है उसमें खांसी, गजला, सीना पूरा भरा हुआ, और यही कह लो ये जो आपके सामने ये धूल मिट्टी हो रही है।
भाई ये खांसी, नज़ला, जुकाम किस वजह से हो रही है? जैसे कि आपको पता है यहाँ रोड कैसा है, रोड मिट्टी वगैरह उठती है, चीन हुकूमत कोई रोड वगैरह बना नहीं रही है। आप पूरे कराची में जाएं, कचरे का गंदगी वगैरह ये सब चीज़ें आपके सामने ही है।
हमारे भी घर में जो भी बीमार वगैरह बच्चे हो रहे हैं, खांसी, नज़ला, बुखार, ये जो गाड़ियों का सिलेंसर वगैरह धुआं चल रहा है इसकी वजह से नज़ला, खांसी, बुखार हो रहा है लोगों को।
एलर्जी होती है सांस में, मुंह में मट्टी, नाक में मट्टी, आंखों में मट्टी, ये तो इंसान के लिए नुकसानकार होती है ना।
बड़े बड़े हमारे को जिस्म पे दाने निकल आते। गवर्नमेंट से हमारी पुरजोर अपील है कि हमारे को कम से कम मरने का नहीं तो जीने का तो मौका दे दो, कम से कम इतना तो कर लो, खुदा तुम्हारा भला करेगा। बहुत परेशान है, घरों पे जाए तो लाइटें नहीं मिलती, रोडों पे जाए धूल मिट्टी, ट्रैफिक चारों तरफ जाम, बंदा क्या करे, कहाँ जाए, मरने जैसा मकाम आ गया हमारे लिए।
We were doing a research study with some European partners, and they were visiting us in, I think it was Jan of 23. And one of the questions that we were looking into was, what is the level of awareness about air pollution amongst young people in Pakistan? And a lot of feedback that we got was that it's not something that you see. Incidentally, in that week that our European partners were visiting, we could not see across the seaboard in Karachi when we were driving to work in the morning. So it was a shift in my thinking that actually it is becoming a visible problem in Pakistan.
Karachi's air pollution is the cumulative imprint of decades of unplanned growth, where estimates of informal transport remain murky. By 2023, Karachi's registered vehicle count had reportedly risen to 6.5 million out of the country's 35 million registered vehicles. Here, the problem isn't seasonal burning or distant factories, it is the city's own engines.
In transport, when you break up what are the vehicles which are contributing most to the urban emissions, as far as transport is concerned, they are commercial vehicles, heavy trucks and buses, because they use the diesel fuel, and that has a lot of impact as far as air quality is concerned. Second is the number of vehicles itself, and we have the largest number of vehicles in the category of motorcycles. Although they are an affordable mode of transport for middle income and low income groups, but motorcycles themselves also have a reasonable amount of contribution as far as poor air quality is concerned. But if we are able to control the larger vehicles like buses and trucks, which are using old engines and the fuel quality in them is not good, especially diesel vehicles, we to a large extent can make a dent as far as air quality is concerned from transport.
There have been people who've looked to see how many cigarettes you smoke and how that equates to air quality. And I think it was in Berkeley and Chicago that they found out or approximated that if you have one cigarette a day, it's equivalent to 12 milligrams of PM 2.5, which is the particulate matter 2.5. So when you do the math and the calculations, that it comes to about 2 or 3 cigarettes a day in Karachi, even in the good days that you can see across the city. And in the winter months when air pollution is worse, it can be about half a pack of cigarettes. When it comes to air quality monitoring, that I think can be really a game changer for people and how they live their everyday life. Because if they were able to understand air quality index in their personal space or in the space that they're going to move in that day, they could take precautions, especially if you have something like asthma and you know that your disease is triggered when there's high air pollution levels, then you can make sure you wear a mask accordingly. Similarly, if you have chronic disease, we can look into ways that we can protect people if they have a knowledge of the air quality levels on a particular day. And importantly, that impact is not just on that day, it's also in the subsequent days after that. So it's a cumulative effect over time.
Air quality data in Pakistan is scarce, fragmented, and unevenly distributed. Without accurate monitoring, residents cannot assess risk in real time, leaving vulnerable groups exposed to invisible hazards every single day. Across the country, monitoring stations cover only a fraction of urban areas, meaning policy decisions are often made in the dark, with the scale of exposure and cumulative impact poorly understood.
We've seen for the longest time that Karachi's air quality index has been pretty poor. In fact, one of the laggards in the whole global scene. And as residents of Karachi, as people who work here, I think this is of great concern to everyone, but also to us as a responsible corporate citizen. And so we decided to see what we can do to help in our small way to improve the data collection and also to help with creating the solutions longer term. And therefore we worked with IBA in their initiative to understand the air quality index a little bit better and to design ways in which we can improve the air quality in not only in Karachi but overall in Pakistan over a period of time. I mean, data is data. The question is who is going to go out and collect that data effectively. And in the absence of government institutions doing that, I think the private sector needs to step up. And we are stepping up to help academic institutions like the IBA to do a very rigorous process of collecting data that then can be presented to the policymakers, who hopefully with the help of that education will be able to design the right policies.
Data is only valuable if it can guide decisions. In Karachi, private sector initiatives and academic partnerships are attempting to fill the gap, but the lack of systematic collection and integration into government planning limits the impact.
To be very honest, planners are not very highly regarded when it comes to decision making. The planners are usually much lower down the hierarchical order of decision making. So really, till you get the planners on the table where real decisions are being made, I think there will be always an operational barrier as far as good urban planning input is concerned. The second reason is that we have not updated our planning laws. Our planning laws were made in the 1960s. The National Reference Manual, which is almost like a Bible for all public sector urban planners, was made in 1987. So cities cannot evolve if you have old planning guidelines. The domain of planning, the domain of urban planning has changed very rapidly in the last 20-25 years. A new type of land uses have evolved. Data is being used much more intensively. Our urban planning regimes do not give that much value to granular data as it is in other countries abroad. And because of that, I think we are unable to plan the cities for the 21st centuries, the cities which are going to be more green and more cleaner.
Within Karachi itself, I'm not clear that Clifton or Defence is any cleaner in its air pollution than Korangi is. I think there's not enough high quality air quality monitors to be able to really look into that and see, what area is a better, cleaner area, so that we could look into this idea of whether these people are being impacted more. At the moment, we can certainly think, are certain practices or behaviors more likely to make you susceptible. So, for example, the risk of a motorcyclist compared to the risk of a person sitting in a car. Those kind of things can be compared more easily. Our patients at Indus Hospital in Korangi have often been of low income groups, and many of these people have had indoor air pollution problems way before outdoor air pollution became something to talk about, even in Karachi. So particularly rural communities, low income groups, they'll be using biomass and wood to burn for heat, for energy, for cooking. And ladies in particular have been exposed to this for a long time. So as far back as 8-10 years ago, there would be ladies coming in with respiratory issues similar to someone who smoked their whole life. and they would complain about their symptoms. And when we look into it and ask them more about it, find out that they've had almost 10, 15 years of this biomass burning exposure in their lives. So indoor air pollution has been a problem for the longest time. But outdoor air pollution, I think, really in the post-COVID era, we have noticed that there's something called air pollution in Karachi. Before then, probably we had a lot of protection from sea breezes. We didn't have such a huge population load. Maybe there weren't that many cars on the roads. These kind of factors may have made it that it was not something that you think about. But now it's definitely a player when it comes to deciding if somebody's respiratory symptoms are being caused by anything other than tobacco or a particular allergen.
Air pollution in Pakistan is no longer a local problem. It is everywhere. Lahore, Karachi, Faisalabad, Multan, every major city struggles with smog and smoke, while smaller towns and rural communities face the same hazards with far fewer resources to respond. For now, the only way forward for Pakistan is decisive action towards clearing the air together.